Excuse me. All right, is everyone able to see the screen, the presentation slides? Yes, awesome. Okay, well, again, welcome everyone. As you're entering, please, just as a reminder, just type your name and your organization in the chat box. And I'm actually going to turn it over to Dr. Cooper to give us our official welcome.
Good afternoon, everyone, and welcome, and thank you so much for joining us today. We're quite excited to have you here at our August meeting for the Prince George's County Health Equity Workgroup. We look forward to using this platform to share important information, discuss bold ideas, and of course, explore opportunities for us to be able to build our community capacity. Your time and contributions are greatly appreciated and valued, and I'm looking forward to a productive and engaging session. And for any new folks, welcome and thank you for joining us. And we hope this will not be your one and done, and that you'll be here for many other meetings as we go through navigating and understanding the nuances and making sure that all of our
Think the state of Maryland assesses about 331,000 plus individuals who qualify under the Affordable Care Act may have to be susceptible to do these renewals. If you know anything about annual renewal of your insurance, if you work for an employer, you know, they always say, don't forget, don't forget, don't forget, because you will get off the rolls. And so if you live a very busy life, if you're an entrepreneur, if you work multiple jobs, if you have kids, if you have a lot of things going on, or if you are not computer literate, it may be very difficult. A lot of people work with navigators to stay and get onto the ACA. And so, how that will impact them if they have to do it every 6 months, to me, feels very onerous on the user, and potentially has equity impact in terms of health literacy, ability to remain on the rolls of the ACA. And if you're not enrolled, you can't receive the services, which means your health coverage is at risk. Also, tens of millions of dollars are needed to implement and administer, right? So, who's going to help these individuals get on there? If they have language proficiencies, if they're deaf and hard of hearing, how are we going to ensure that they are also going to be able to meet the needs of that? The other one is the state directed payments. Eliminates the use of state-directed payments to establish rates above Medicare rates with temporary grandfathering or certain state-directed payments, and are expected to impact the HEAD model. So, the state of Maryland has embarked on a total cost of care, which really looks at how do we standardize the way we reimburse our providers across the board, irrespective to their payer. So if you have Care First versus Cigna, it's a way to kind of say this is how we are going to ensure and essential services that they all must provide. And we were able to leverage this model through support of CMS or CCMS, which is the Centers for Medicare and Medicaid. But that potentially has some, not that it's going away, but it's going to make it a little bit harder, I would say. So it really does have an impact on our primary care investment to the tune of $27 million. It also impacts our qualified improvement programs by 25. And we stand to lose approximately 52 million in federal funding. And so it is not insignificant by any means, but it is what we are that the county and the state are looking at. The other part is cost sharing requirements and mandates imposition of cost sharing for the ACA expansion not to exceed 5% of the total income. And certain services are exempt from these requirements. This one, I'm sorry, the one before it doesn't go into effect until January of next year, and this one does not go into effect until October 1 of 2028. But it looks like participants who currently get $1 or $3 prescription drugs, we don't know if these copays will meet the requirement, but it could affect almost 330,000 people in the ACA, and it requires that we track expended copays and ensure cost sharing doesn't exceed 5%. So the reporting burden is going to be higher. The other one is erroneous payments. It expands the federal government's authority to take back the funding due to the federal or state auditing findings, even when the state is operating in good faith to address the errors. This will not take effect until October of 2028, but it's indeterminate what the potential or significant or fiscal impact. But they're stating that if the state, even if the state says, hey, there was an overpayment and they're already recouping those payments or working to recoup those payments, the feds can usurp that power and try to come in and do more oversight or overlifting. So those were some of the higher level things that we saw that could be impactful to us. They also put out a FAQ, and so I will not read all of this for you, but I think it's important for you to understand that one of the biggest and most significant, and I will share this with Shanae so she can share it with you. Some of the biggest changes is that there's been a lot of scrutiny around our ability to serve individuals who are undocumented or even of legal resident status. And that is not only applicable to Medicaid, but it also impacts our wraparound grant services. Anything from Head Start to HIV services, maternal child health services, WIC programs, any public health program you can think about. There's been a strong um, position by the Department of Health and Human Services at the federal level that is restricting our ability to be able to serve them, which is going to be a little difficult considering that we do kind of a blended braided model where the state covers those individuals at the same rate as our Medicaid individuals, and it's going to impact the ability for us to wrap around with the grant dollars that we use to support some of those funds. Um, Again, I will share all of this with you. The state has a fabulous website that they are working very diligently to hold. What this looks like is the bill, which you could call it, is just big. I'm not going to say anything else. I'll leave my colorful commentary out of it. It is out. Appropriations begin at the end of September, going into October. It'll be interesting to see how that all looks as that pertains to what happens at the state level. There has been discussions, and I've heard that we might have a special session. It has not been confirmed, and I've been reaching out to um, our federal, excuse me, our state body of MACO to MHO to see if there's going to be any word on if the special session is to come. If there is a special session, I would presume it will be directly related to the budgetary allocations and how they come out. Right now, we have our legislative session that runs from January to the beginning of April. That during that time, our budget bill was appropriated, and so everyone is operating at the state and local levels based on those budget appropriations for FY26, which we are currently in. The funny thing is that our appropriations start in July. Appropriations for the federal government starts in October. And so we usually presume that we will get level funded or we will have slight augmentations, but never enough that triggers us to do any type of major cuts or shifts. We do not know what it's going to look like this year with all of the federal changes and what appropriations will happen. Some appropriations are statutory, like Ryan White is a statutory budget, but they can reduce the amount of money that Ryan White gets, which reduces the amount of money that states are allocated. Um, there is an appropriation for a block grant for those who work in behavioral health. So the substance use and the maternal and child health is an appropriated appropriation within the budget, but they can reduce how much money we get. So that is why the allocation budgets will be very interesting to watch this year in order for us to see what those appropriations will look like. Depending on how that looks, I would presume, and this is just Stephanie's assertion, that we might have a special session, and that special session will look at how the state plans to um, respond to the federal budget, because a lot of the work that we do, at least in public health, is in part or totally funded through our federal funds. But that is the overview. In terms of Medicaid, I think also a lot of things, how they have stagnated it out. Not everything is happening all at once, but it is happening around, midterms. It's happening post, the end of this this federal or this presidential cycle. So by 2028, you're seeing some of those things happening, with the understanding that I think it was strategic in the way they did that, so that local consumers won't feel the immediate sting of it, and there'll be some separation between when the bill dropped and when we start to see the implications, much like we saw with a lot of the taxes that happened back in like 16 and 17. We didn't start feeling the effects until like late into the new presidential cycle, and so the average person is not fully aware of how that really happened, and how that and who they correlate those inflation issues or those tax burdens onto. I think was a strategic move. But with that, I'll stop and open it up for any specific questions that you might have around some of the things that we're anticipating or are believing are coming down from the federal government.
Stephanie, thank you so much. Everyone, I'm one of the co-chairs of the Health Equity Workgroup for Prince George's County. And with this information you shared with us, we're going to see a lot of gaps, and we're going to see a lot of disruption of services. So I think this is the time that we need to really brainstorm on how we're not going to come up with solutions for everything, but this is our role as solution architects. How do you see us working together in advance, because a lot of these things are coming down the pike, to
hmm
bridge those gaps or alleviate it so that the impact won't be so devastating?
I thank you, Dr. Gibbs, for that. I think it's a really good question. My thought process is like, the law is the law and the rules are the rules, right? And so there are certain things you're not going to get around, but there are certain things that we should be thinking about. How can we help seniors? How can we help mothers and children? How can we help our English as second language proficient residents? How can we help individuals who are not health literate and get them there? So could we be advocating, at the local and state level for, more navigator support, community health worker support? Can we be working to make sure that people are aware of what their resources are? Can we be advocating to ensure that people know what's in the bill and informing them of what the truth is, and to making it in a way that it doesn't get lost in the alphabet soup or in the headlines? Because some of these things are not going to happen tomorrow, and we have a short attention span, but the impact is long lasting. So how do we keep our communities well informed beyond tomorrow about what's happening today? Because they're playing the long game. This is not just something that's happening tomorrow. This is an erosion of our entitlements. And I could go on and on, but I know that the ask was specifically around Medicaid. But there's a lot of things that are occurring that are really are erosion to how we look at safety nets and public service and public safety that are being tested and tried and pressed up against. And so I think, in the immediate, we need to really be thinking about how do we help the most vulnerable populations. Do we need to do data analysis? Do we need to see where our most vulnerable communities are, and then making sure that they have what they need in order to be able to get those services in place? That's what I think, but I think this group is primed for that conversation, and that innovative thought process is going to be essential, because they're definitely architecting things, and we have to be as stealthy as we can to deconstruct it as well.
I believe Sharon, you had a question? Your hand is up.
No, I just wanted to add, I'm Sharon Zalewski. I'm the executive director of the Regional Primary Care Coalition, and I see that Rodrigo is from La Clinica is on the call as well. And I just wanted to point out to people, for people who don't kind of work on the ground, that the 6-month eligibility requirement creates an incredible issue around what they call churn, which is people falling on and off Medicaid. And most often people, one is that it's a burden to have to reproduce and submit all of the documentation. It's eligibility determination is what they're doing. It's a huge burden on the system. It's a huge burden on the individual, and it's a huge burden on the intermediary, which is often the health center. And more often than not, people fall off the rolls because of administrative errors. They left out a document, they didn't do something, And when that happens, I think there's another piece of the Medicaid change that I don't know when it starts, where they're not going to do retroactive coverage. So in the past, they would say, well, we'll cover 3 months prior to the time you're eligible. If they take away the retroactive coverage and people are falling off of Medicaid, it means they may be receiving services that nobody's going to be reimbursed for. So it's a problem for the individual who, if they need something health wise and they're showing that they're not on Medicaid, they may not be able to have access. It's a problem for the health center who provides a service, who then may not get paid for those services. So all the way around, it creates a mess. And I think Stephanie pointed out, the issue of having well-informed, a well-informed health literate community as a whole, and providing, I don't know if I'm even allowed to say this anymore, extra assistance to populations who are not computer literate, who may not have English as their first language, and who don't understand how our health system works or doesn't work. It's going to be really critical in terms of the most the first needs that we're going to have to meet. There's going to be many more after that, but those are the first ones.
Yeah, I totally agree with you. And I think also it'd be remiss to talk about like federally qualified health centers who or clinics and services that serve the undocumented or the those that are Medicaid recipients the most are going to be hardest hit too. And so for those providers who do that yeoman's work, it's going to be painful across the board. So I'm glad you raised your voice for that, Sharon. Thank you. I think
Stephanie.
Stephanie, yeah. Hi, Stephanie.
Hello. I see that we both have the same name, so we're great people.
Yes, we are. Yes, we are.
Thank you for your summarizing what's happening and just making it really clear. And then Sharon brought up some really strong points. And so where I was looking at when you were talking about all the issues that we're having, and then Sharon also just kind of brought it home. My role at the college, I am the program director as well as the associate professor for our community health workers certificate program and our health navigator program. And so my whole thing is that definitely we need community, right? Because we all have different pieces to the pot. And with these cuts, it's going to take the community to work together collaboratively so that we can address the issues that you have brought up, and Sharon have brought up, and I'm sure other people have other things that they're going to see and what we're going to see. But definitely, because we have this program, I'm pretty sure with the system going to be clogged, you're going to need a lot of these health navigators, community health workers. And so, you know, there there might be spaces and places for us to work collaboratively, and I'm definitely open. So if there's anybody or any needs or anything that anyone needs that I can work with, or we can do something together, whether it's getting people certified or having people go through the program, whatever it is. But I just definitely think that it's going to have to be a very collaborative effort. This is not something that we haven't done in the past. Before, it's, every time there's a new administration, there's something getting cut or whatever. But I think, to me, in my lifetime at least, this is one of the worst things because there's so many moving parts and so many things, and I just feel so horrible for our vulnerable population because they are going to be the ones that are going to, be left with a whole lot, and especially if they have health issues, and if that churn continues to go and they're missing documents or they're unable to make it, then they're no, then they no longer have access and may have to wait a while before that, and that's going to present so many problems. So I think from a global perspective, it has to be a collaborative community level of all of us working together.
Yeah, I totally agree with you, Stephanie. And I think that you are bringing up a valid point. Like, how do we, leverage some of the existing services that we have? And sure, I agree with you too. In my lifetime, I don't remember. I fell into public health, and I say that very earnestly because I was in clinical health and clinical work for a long time, and I fell into public health right before the ACA took a hold, and I was working for the AIDS Drug Assistance Program, which was really provided and really erected for the ability to wrap around individuals who are not Medicaid eligible, who fell above the federal poverty line, but yet were not
Mhm.
having a livable wage, right? And so at the time, all they could do was pay for people's prescription drugs. And through
Right.
the Affordable Care Act, then we were able to start paying for
Mhm.
people's premiums, which meant people, for the first time in their lives, not only got coverage for their HIV care, but they were getting comprehensive coverage. We had people who had
Mhm.
cancer and HIV, and were now, for the first
Mhm.
time, being able to get comprehensive treatment. And so what we were doing was we were really eradicating the loophole, and taking away the cost burden of healthcare, which puts millions of people in debt every year if you do not have compensated care. And so I feel like it's a reversion back to that. And
Yeah.
I do not miss that. That was not very long ago. That's 2014. Like, and so
Mhm.
to me, it's unfathomable that we're here. But I think to your point, it does require that ingenuity of taking it back to when we did figure out ways to connect the dots and create those connections and do that. And I do love the community health worker program so very much. In my past role, I was a part of, helping to establish the certificate program as even as a whole viable process. And so really excited to see it as at community colleges that individuals are now going into the pathway of a career of that. And we see every day how valuable and how priceless those services are. And so I'm hoping, through some, thinking maybe in this Think Trust, and you bring it up and you share it with the health department, could be a way for us to find pathway forwards, because that's what everyone is talking about. You all are asking
Mhm.
the question that the council is asking, that, we're getting at the county exec level, that we're getting at the state level, that I get questioned about this quite often. And so, I think I welcome and really implore you all to throw everything at the kitchen sink at it, and let's try to think out of the box to really meet the need. So I appreciate you amplifying your voice on that.
Amira, did you have a question?
I have a question slash comment. Um, I want first, let me thank you, Stephanie Little, as well as Stephanie Burke and Ms. Sharon, for your comments so far and for what is really shining through to me, which is your passion. I interface with family caregivers, and one of the audiences that need to be directly addressed as well as utilized in disseminating this information is the people who are caring for people who find themselves formally or or informally making these decisions for their loved ones and helping them to navigate. And the other thing I just wanted to say is we're just kind of sharing and just understanding. I think we're hyper aware of our location and the importance of our work and the importance of even collaborating together. Um, I'm one of those people. Always make sure to stop and breathe and make sure that you are okay, because this is really heavy stuff. Those of us who understand what is going on are rightfully like overwhelmed, trying to figure out a thing and a response, an adequate response. And it almost seems like every day is something else. My encouragement in that space is that we do not approach it from a slipping into any form of boiling the ocean. To scale, there are going to be things that we do through our roles professionally, but one thing that myself and my colleagues and my network have been doing is we are assessing like where our time and effort are going, like almost like an audit, because some of us can carry these messages into other places where we serve. And I think that it's really important to think where in your network, if you are, thoroughly networked through community organizations or faith-based organizations, if you're active in your alumni groups or in even like your neighborhood level types of associations, thinking about how we get information out to audiences that don't formally gather where we give our professional opinions. I find that to be very helpful. And Department of Family Services, manages information tables, much like other county agencies. We're managing these information tables and going out to community events, but just thinking even more intentionally and critically about how to grow those informal networks, because you sometimes get a great hit with a person who happened to walk up to your table because they want that pin or they want, the little giveaway thing you have. but you get to plant a seed that then goes back to a congregation of 1,000. And people now know that we have community health workers and health navigators or family caregiver programs, things of this nature. So I just want to just offer a word of encouragement that we some of this, sometimes when we gather, it's a little bit of preaching to the choir as far as sharing, but we walk away knowing much more. I just feel like, don't overlook the fact that you have something of value that doesn't come to this meeting where this information could be really impactful.
Cheyenne? Cheyenne, did you want to mention something or add
Yes,
to the
yes.
conversation?
Yes, thank you. So it seems like we're all of this general consensus, like we all have a role in making sure that our communities get clear, consistent information. And even though we are all representing different organizations, different networks, I think it is important that the language that we use it's consistent, especially in the world of misinformation and social media and all that. Like, 1 second the message is Medicaid's getting cut, and then another source might say no, it's not. So like it's just a lot of confusion, and people don't always know what's factual, what they can trust. So I guess my question is that something that this work group could maybe take the lead on? Is it something like, how can we translate all these complex policy changes into plain language for the public, which is void of opinion, void of our feelings, just these are the facts, kind of how you did today, Stephanie, like you just gave us a very great brief summary, and even taking that and making it even more plain, for those who aren't in this world and aren't talking about this on a daily basis. Is that something that we could do? Does something like that already exist? Because I think that's really important. Messaging is really important right now. And if the message is consistent, then it doesn't matter where they're getting the information from because the message is consistent. So just food for thought and kind of curious.
I'm going to
I
jump
just want to,
over.
sorry, I was going
Also,
to,
go ahead.
sorry. Stephanie Burke, you mentioned something that's going on as far as the community health workers. There is already something that we can build upon. I work closely with Dr. Stephen Thomas, School of Public Health at University of Maryland, and we're using unconventional locations. And I think our mayor said the same thing, in which we use barbershops, existing trusted spaces to convey messaging in a way that is acceptable and understandable, and linking individuals to the healthcare system as well, bringing healthcare providers to the barbershops, hair salons, to again make sure that not only we identify those health issues, but once identified, connect them to the healthcare and create that I guess trusted space so that we can have that continuity and coordination of care and try to build upon trust in the healthcare system. The other thing I want to mention is, again, we do have through the state of Maryland also the community health workers, and they have a monthly meeting. And so how can we get them involved? Because we have this infrastructure. How can we build upon this existing infrastructure with the resources that we have? So I would think that if we can have a side conversation, and I think this is the beginning of building that conversation on not only, again, strategizing, but placing actions besides those strategies in order to bring about those results that and outcomes that we're looking to achieve. Stephanie Little.
You were mentioning my name, and I'm already connected with the same people, so that would be great. I would definitely welcome that.
Okay, great. Let's
Hmm.
continue this conversation on after
Sure.
this meeting. Okay, look forward to it.
Okay.
Stephanie
I
Little, I'm sorry for interrupting you
No, no,
earlier.
no, no. You're fine. You're fine. No, I think what you asked, Shanae, is really important. I think that if you guys are, I would strongly love to see this group do that. I think, um, where we normally would go to our trusted sources, such as mainstream media, such as news publications that we normally would trust and believe, are also being cited for spreading disinformation. And I think where there's a lot of areas in which people are not trusting, we're looking at our counties that reflects the community as a whole to be a trusted source, right? And so, I try to tell individuals when I speak to them about, and I'm not sure who said this, maybe it was a mirror said, really not trying to boil the ocean and taking care of yourself. A part of that also is finding credible sources to get your information that you don't feel like you're not being entertained with a sprinkle of information. So it's really important if this group is really looking at that could be a trusted source, getting from cited sources, because when we look at it, or at least when I look at it, because even internally we talk about it, and they're like, well, I got this article and that article, and I'm like, well, there may be an injunction against this, and there might be a court case for that, and this is what the injunction says, and so it requires a lot more effort, but I think the due diligence provides the legitimacy of the data and the legitimacy of the work, and it takes away the emotion. And the reason why I wouldn't come to you with all of my commentary is because it is emotional. It is something that impacts all of us, but it doesn't help us when we're trying to spread a concrete, reliable, and evidence-based information. And so I think, now more than ever, people are looking local for their information. People are looking towards local government and local organizations for trusted sources because they do not have trust in the federal government for a myriad of reasons and for a myriad of ways. And a lot of times it is our community-based grassroots organizations that really are the trusted sources. So I'm very familiar with Dr. Thomas in the barbershop talks, and so that is why those things are very critical, because we trust our barbers because they're not gonna mess my line up. I'm gonna trust my beautician because she's not gonna cut all my hair off. I don't go to everybody. I want my hair to stay long. So you have the people and you can trust, and so that is why we need to get that out. So do we create flyers and say here's a little link or here's a QR code to get 5 actual sources for information? Here's the top 10 things you should know about the new bill that was passed, and here's where you can get more information if you want to know it. I think those kind of things, and then partnering with already indoctrinated and trusted and evidence-based groups that communities go to, is a good way to leverage it. And it might not seem like us a lot, but information is power. And what we need to do in this season is empower our communities to really understand the impact of what's happening to them, not just right now, but as we go forward, and understanding how we can utilize our own, civic systems to really right the ship, because I think that also gets lost upon us. If anybody was on the last in-person meeting that we had, I changed it to a legislative one-on-one on purpose because I chose to inform the group about how to know how to navigate the legislative system. How many people really understand that process? It was things that I didn't even know as a policy person. And so those things are really validly important. What we know, we need to teach, and what we teach, we need to demonstrate. And that way we're empowering our communities to not just be a product of what's happening, but be architects and changers of what they're seeing. It is we the people, and we all stand up and fight against it. That is what this is, and that's what equity is all about, at least in my assertion. So that's where I get my energy from, right? And I think those kind of things are important. So as much of credible information we can get out in a simplified way and leveraging those systems, I think is ideally important. And that's why, Dr. Gibbs, I was so excited to say something. So forgive my eagerness.
I feel your passion. Thank you so much. Sharon Zolinsky.
I think Stephanie was before me, Stephanie Burke.
Oh, I apologize. Stephanie.
That's okay. Thank you. One of the things that I was thinking about, and I would be very open to it. I think getting information out to the public and to the community is very important, and we can do that in a myriad of ways. But I was thinking more of a social campaign, and I mean, since I have students, we can utilize the students. They come up with some great stuff. Of course, we have to have some parameters, and if they come up with it and, we all agree that it's okay to use, that could be a way that we can disseminate it out to the public. Not only that's just one way, but that's a way that I think that could be utilized and we working in community.
Sounds great. We'll continue this conversation in that area as well. Sharon.
So I was thinking, I was listening to everybody who was speaking, and I think there are actually two levels of information that need to happen. One is for advocates, activists, and people who will who are engaged in actively trying to actively be engaged in civic action. And I would point back to, we do have our training modules for health equity ambassadors that I keep wanting to revisit, because it was a lot of work to put that together, and I would like to see it put to good use. But the other is that just doing tip sheets for how to help individuals get what they need. There are policy changes that are happening that impede people from being able to access things. And I'm speaking from personal experience a little bit. I had to deal with the Social Security Administration regarding an error, and I called them. The first time I had to do it, it all went really smoothly, and it was really easy to take care of an error. The second time, this time when I went to do it, I talked to like 4 different people on the phone. Somebody did answer the phone, but then the woman on the other end of the phone said, "Well, honey, you can send in the documentation, but there's nobody here to help you. And we're not going to be able to make that change." And so it's letting people know that if they're interacting, they need to start early. They need to be persistent. They may need to have an advocate with them. And it's like just a tip sheet for things that you wouldn't think you would need a tip sheet for.
Thank you so much for sharing. That is so true, Sharon. Navigating the Social Security benefits, if you don't have someone there, if you don't have your patients, or you don't have your questions asked, and because they're understaffed, it's going to be a long, long process. They're trying to encourage folks to go online, but again, if you're not savvy using technology, then it creates another barrier. So
Just from my experience, when you go online, then they redirect you to go to your office. And when you go to the office, if you still have an office in your neighborhood, in some cases, they're not taking walk-ins, they're only taking appointments, and they're scheduling appointments up to like 3 to 4 months out. So yes, people need to start their processes early and be prepared that it might take 6 months to a year to address what they need to get addressed.
Absolutely. And it's so interesting that we're tackling this topic with Medicaid, because we're looking at the general population, but it's also those individuals who are returning citizens. And this is impacting them as well. And one of the areas, I operate in the reentry space as well. And one of the concerns is continuity and coordination of care. And as you alluded to, Sharon, and speaking with Medicaid representatives as well, you want to start this process early. So basically what they're advocating, as we have here in the state, or trying to get going in the state, is starting that conversation and those benefits before individuals are being released or become returning citizens. And what the areas of concern, as we have here, would be continuity and coordination of care. And especially when you have individuals with chronic disease, care and the timeliness and accessibility of care is very, very important. And then, of course, they talked about the case management model, in which you have, like we said, that person that will be there to help individuals to schedule those appointments to navigate the system and everything else. So those are, some of the concerns when we talk about Medicaid. it's everyone. It's impacting everyone. It's disruptive and fragmenting the already stressed system. So how do we look at that? And then speaking with folks from University of Maryland Medical Systems in the Capital Region, a lot of folks are using the emergency department as their first point of care in the continuum of services. And we all recognize that those systems are being overwhelmed and are coming in for those simple problems. And then after they are being discharged, there's not a warm handoff because we don't have that primary care support in the county. So this is why these spirited conversations are, we can identify the problems, which are great, but now let's go to the, movement towards, like everyone is saying around the table here. How do we go through the actionable steps and those strategies? And everyone, again, the focus is in those conversations I've had in the reentry space, in this space, is how do we build that collective community, those resources? How do we leverage those resources and make it so that we can, in reentry world, reduce recidivism or break the cycle of, generational poor health? So again, we're in the business of, creating good health options for individuals. So this is wonderful. This is why platforms like this are so very important, and having the right people around the table and the people who are directly impacted as well could add value to this process. Thanks. Denise?
Yes, this is some very good information and discussion that we're having. Um, Piggyback on the return citizens, we have two fellows here at CECG that go to the Montgomery County Correction Center. And what they're doing is getting them, the ones that's being released, to apply for SNAP, for Medicaid. Uh, the wraparound service we have here and in the county. So I'm glad you did mention that. But the thing is, for me, when I used to work at the Mission of Love charities, we used to follow those. I mean, literally follow them, but stay with the client to find out what they need, where they started at, where they need, and follow them, to get the resources they need to help them get on their feet. So that's another thing that's going on here out here in every county, because we still fighting for the homeless. What the administrator have done and what he has mentioned about getting them in the shelters. There is no room in the shelters for these individuals in every county. It's overloaded before even they try to get in the shelter for those that's willing to get the shelter. Not only that, they get in the shelter to get the help that they need. So I wanted to pick it back on that part that you was talking about, the return citizens, and I think that's a good thing. We could start. We have already started with those individuals. They was doing that, I think, before I even got here at CSCG. So I just want to share that information, and I'm happy to be on this Zoom call to hear what everybody is expressing, how I feel as well. And one of the young ladies has mentioned for us not to get anxiety over it, because that can show through us, through these individuals, while we're trying to help them. So we need to stay positive and get the information out to them as well. Thank you.
Thank you. And we're working closely with Dr. Anita to bridge those gaps that we've identified. So thank you and your organization for all that you do. And it looks like Ashley.
I just wanted to add a piece in terms of awareness and assistance to work in collaboration or partner with the school system as well. We already work with the health departments for immunization clinics and other health initiatives, but we have a lot of students who are beneficiaries of Medicaid and their families. We have some students that receive treatment at school that is reimbursable through Medicaid, which I'm sure will be affected down the road with some of the changes that were mentioned. But in terms of working with the school system and our community schools programs as well, I keep hearing wraparound services, and that's one of the themes with the community schools program also, which is geared towards helping underserved or underprivileged families and children. So that may be another avenue as well, to partner, one with the community schools program, rather, to target and assist those families who either may be affected, who need assistance with the more frequent re-enrollment and verification, things of that nature, and as well in terms of awareness, getting the information out, be it at events, through the schools, through the health rooms, and et cetera.
Great information. Thank you for sharing. I think this working, again, this is all part of that collective community effort and bringing about those collaborative efforts to address and bridge those gaps as well. Marlene.
Yeah,
Oh, you're on mute. Can you unmute yourself, please?
yeah, sorry.
No worries.
Yeah, I'm Marlene Orantes from Horowitz Center for Health Literacy, and I think that we find ourselves in a situation similar to the COVID pandemic. I don't know, but it's something similar that in the COVID, we improvised many things. But now we have the chance to train, to implement many stuff for facilitate and provide to the community trustful information. So it is crucial that health information will be clear, trustful, and easy to understand. And I think that a community health worker can effectively advocate for our community. And we can begin training them right away to assist us. I think that we can work together to create accurate information and provide training for them. And Horowitz Center is here to collaborate with this group, as always. So think about it, and then we have this huge problem that in one or another way, we will be affected, all of us, wherever it is, the way. Think about it. So I think that community health worker can advocate and can organize, and also we can organize all of those training, and those can be very simple, very clear and trustful, and disseminate all those information in anywhere. I think that they, as a community health worker, are the bridge from the entities or organization or health department with the community. Because right now, the community or the consumer or the population or whatever you want to call people, person, they have misinformation, and they are afraid. They are suffering a lot. I can tell you. So this is my thinking. So let's work together.
So, yes, Stephanie, you bring up some excellent points there, because we hear what's pending and imminent as far as Medicaid and some of the cuts and some of these changes. But I don't hear anything in terms of what these legislators or this, whatever you may call it, architects of this, are looking at as far as the cost of the lack of connections based upon these cuts. You know, the cost not only to the infrastructure, but the overall health of individuals, as you mentioned. And I think people don't realize the value of these programs and how the implications that are made with the absence of these programs and individuals, and building healthy communities and taking away from those particular resources that are available to do so.
Yeah, I think, at the core of it, what has been publicized is that this is supposed to aid in, essentially continuing some tax breaks for certain, levels, right? Like at the core of it, like if we're going to be honest and transparent, that's what it's for. I think not all legislators feel that way, but I think a lot of the legislators that architect this had no concern. It is equivalent to there's been word that, individuals who receive Medicaid and other services have to work. But we know that those individuals that are on Medicare and Medicaid are those who have, developmental disabilities. They might have chronic illnesses. They might have other comorbidities that prohibit them from being able to work. They also are not accounting for our elderly population who rely on Medicaid to essentially live in convalescent care in skilled nursing facilities and nursing homes. And those individuals are bedbound sometimes. And so it is the lack of understanding of whom they are impacting until it's there. And it's also the public's, I think the public has a lot more awareness because this bill has been received grossly, not well. Overwhelmingly, the polls on it does not show that everyone is favorable about that, but that requires for all of us to be active and actionary at the times when it requires it, if that is our feeling. And I think what we have to do is within our networks and collectively through groups such as this is start to document and quantify the impact. What does it look like in dollars and cents? And what does it look like in terms of people being unserved? And how many people are coming off of the rolls? And how many, agencies are being impacted? When the Affordable Care Act was going through, initially, a lot of people, when they tried to run to take it away in 2018, it was a lot of ground swelling from the community that said don't do that. And so I think that goes back to that. What can this group do to leverage and empower the voices to say this is this is the impact it's having on us? So I do agree. I do agree that that there isn't a consideration of that, and I think that that's why we have to be those voices that elevates that conversation. And it's not just to give certain people, a tax break, or it's not. These are not just people who are being lazy. These are people who are most needy, are most vulnerable, that cannot do it for themselves. And also, it's for our people who are working and who do not have a livable wage, and they don't have means to pay for health insurance, um, and don't have the resources to get regular health care. Because if they did, they would. They work every day, sometimes two jobs, but those jobs do not equate to having enough resources to pay for health care or pay for the other benefits that they need that are subsidized by programs such as Medicare and Medicaid.
Denise, did you have another question or okay, you're okay. Sharon, I see your hand is up.
I'm more cynical than Stephanie is, and I am just going to say this, which is I think part of the goal is to ensure that these programs, these long-standing social safety net programs, don't work, so that there's an excuse either to eliminate the program, privatize the program, or do something else with the program. So yes, I think we should collect stories about how real people are being impacted on the ground. But I think the stories need to be shared with those closest to us, our county council, our state representatives, people who are going to help create solutions, not people who are going to look at them and say, oh, that's too bad.
Right.
So that's my most cynical take on this. And it's, I don't want to alarm people, but I think this is a hair on fire moment for everybody, and we need to all wake up to it.
Absolutely. Absolutely. Amira.
Hello again. I second all of the wonderful ideas that are coming out here. And I realize that you have made mention of like the power of storytelling in crafting a new narrative around what's happening, or improving the narrative around what's happening. I think there are a lot of things that are understood, that we are understanding. We're nodding our heads and everything, but we are not mentioning per se. To Sharon's recent point, it's a little warm. It is a little warm, but I am trying to figure out where do we get the biggest impact for that, for telling the stories of people that think that it's not impactful until it happens to them, or that people are not realizing, are caught up in some of these cuts or some of these scaling back. But because you don't think of those types of people in these types of programs, it's almost kind of too late to say anything. We deal with a lot of that. Not too late to say anything, but that's a missed opportunity, because I do think that people think that their participation in the program is justified and other people are a problem. So even in telling the story in Prince George's County, where the county appears to is very diverse, there's a lot of powerful stories here about who's actually served that may not be in the places or look like the people that you think are in service. So when we think about talking points, or we think about whatever language we craft for this, again, professionally and personally, we have to kind of strip it down to, at least in my work, we have a whole conversation about poverty, and about lack of resource, and all of the other words that actually mean poor or poverty or not well resourced, not having what you need when you need it, not having the options to reach for what you want. And you kind of have to take what is a part of a thing. Because again, I think that people think that that is something that happens to others. And it's not something that is actually actively happening to them. They might be using different language to describe their situation.
So true. Thank you so much for sharing. Any other feedback or information? Any questions? Well, Stephanie, you, as always, have knocked it out the park. You have provided us more information that's going to not only help inform us, but the networks that we are operating within as well, and helping to inform and getting people involved and amplifying those voices. Because as members of this particular group, we as a body are amplifying those voices that are so often unheard. So it's important that we continue to keep ourselves informed so we can inform others. And what I did hear through the common theme through this whole conversation that we have is not only amplifying voices, but also utilizing what we have in place. Like Sharon mentioned, we have online, through the county, the health literacy. How do we need to tweak that? Because again, it's not one, this is dynamic. So that means that we have to constantly update it and make sure that it's doing what we have designed for it to do. So, maybe sanctioning off folks who will be willing to take on that task. The other area, again, that's part of the messaging, is the community health workers. How do we mobilize our community health workers to build upon those bridges and, hopefully close those gaps? And just, again, this is the time that we have to be strategic and intentional. The other thing I heard was, how do we maintain continuity and coordination of care? And especially the, vulnerable populations, ensuring that populations are being able to be seen in trusted spaces, safe spaces, so they can receive the appropriate care in the appropriate setting and the appropriate which is encompassing the appropriate medications as well. So we definitely, we have our, challenges ahead of us, but as in anything else, we are resilient as a community, as a group. So again, this gives us more ammunition. This gives us more information so that we can contribute to building that knowledge and using that information and data to inform policies and speak to our legislators and let our voices, and those who are not able of speaking, amplifying their voices so that they're heard as well. Any other questions or anything that, before we move on to the next agenda item, that folks would like to share with Stephanie, since we have her attention today? We were so blessed to have her.
I just
Okay.
wanted to say thank you all for allowing me to come before you. It was a blessing and a pleasure for me to be amongst you. Thank you, Cheyenne, for all that you're doing. You're hitting it out of the park for being the new kid on the block. And I just say, it always gives me hope when you're with equity-minded individuals such as yourselves, and we don't give up hope. This is a time when we dig in. This is a time when we really show our resolve and our resilience, and this is when we shine. When it looks dark is when on the other side comes the sun. And I'm an optimist. I know Sharon comes from another spot, but I'm always glass half full because I feel we've charted uncharted territories before. We've come through murkier waters before, and we've been more resilient and more resolved. And this is just our generation's time of being tried and tested. And so now we will rise to the occasions, and the history books will look favorably upon us if we are diligent and if we are consistent and if we're steadfast in our beliefs and our commitment to serve those that we care about and love most of all. So happy to be a partner, happy to partner with you in any way you feel need, and look forward to coming back anytime you need me to come back.
Thank you so much.
Thank you
Have a
so much,
wonderful day,
Stephanie.
y'all. Thank you.
You
Have a
as
great
Thank
day,
you,
well.
all.
Stephanie.
Too.
Bye-bye.
And you all have good, well.
So I guess before we hop off, I will share some community announcements. Let me go ahead and share my screen. Thank you all for such a lively conversation. I've learned a lot, I've gained a lot, and I'm really looking forward to next steps. So I'm sure we will be in touch with what that might look like so we can plan accordingly and be most effective in our outreach efforts. So let me go ahead and share my screen just so I can share some community announcements with you all. Okay, many of you know August is National Immunization Awareness Month. Again, organizations all around are utilizing this observance month to highlight the importance of vaccination for people of all ages. And so Prince George's County Health Department is doing the same. They are hosting back-to-school vaccine clinics. They started this month on the 6th and will continue through September 27th. There are a variety of clinics at multiple locations. Some are listed on the flyer. You can scan the QR code for more information. They have weekend and weekday availability. And so I will make sure to share this with you all after the meeting. Prince George's County Extension will be hosting an open house on Thursday, September 4th. From 5:30 to, I believe, 7 p.m. And this is for residents to learn about some of the free community programs that they have. They're giving away some goodies. So for those who like ice cream, if anybody has a green thumb, this is your opportunity to go out and engage with Prince George's County Extension. The flyer and registration link are on this slide, but I will also make sure to share that out as well. The Prince George's County will also be having their 2025 Family Caregivers Conference on Thursday, September 25th. This is from 10 a.m. to 2 p.m. Again, registration link and flyer on the slide. This event will take place at Martin's Crosswinds in Greenbelt, and it's open for anyone who is caring for older adults or any individuals with Alzheimer's disease or any related dementia conditions. So if that is you, or if you know somebody who is a caregiver or is just interested in gaining some more knowledge and information and be connected to resources, please feel free to share this information out. And also note that registration is required. So please make sure you register if you are interested in this event. 988 training. Our partners with Every Mind and Health and Adventist Healthcare are offering a webinar that is designed for to help healthcare providers understand the 988 Suicide and Crisis Lifeline, as well as its critical role in mental health and crisis response. So this webinar will teach you about the key services of 988 services. It includes 24/7 counseling, connection to local resources. I know that they had a session on the 19th, and they have their last one today is this evening. So I think some people have said they've already signed up, and if you haven't, you can sign up before 6 o'clock today. Okay. International Overdose Awareness Day is Saturday, August 31st, which is still crazy to think is right around the corner. But some of our partners will be at the Laurel Multi-Service Center for a training session on how to use naloxone. So many of you know naloxone is used to potentially save someone from an opioid overdose. So this is an in-person event. It will provide you with the knowledge and skills you need to act quickly in the event of an emergency. For those who do attend, you will receive naloxone upon completion of the workshop. So please feel free to share this event, register, sign up, attend yourselves, because we don't want to miss the opportunities to make a difference in our communities where we can. The second annual Health and Wellness Expo will take place on September 20th at Trinidad Baptist Church. There will be free wellness checkups, free dental screenings, fitness demonstrations, and so much more. So if you are interested, please feel free to come out, share with your colleagues, share with your networks. This is a free and open event. So again, just share this out. Registration link is included, but I will make sure to send that out. And then I think this is my last announcement. American Diversity Group, ADG Cares, they're promoting their services, which provides no-cost, culturally competent health care to underserved communities. It's open to all, regardless of insurance or immigration status. They provide chronic disease management, preventive care, health education. Dr. Cooper, I don't know if you want to expand a little bit more on this or share a little bit more. Oh, you're muted.
Yes, American Diversity Group, they are in Montgomery County, but it's 2 blocks from, or a block away from Prince George's County. They're separated by Cherry Hill Lane. Anyway, they offer comprehensive services ranging from healthcare, which is primary care, to maternal health care. They just want to work with us to be, again, able to fill that gap that exists where we have a low amount of primary care resources in the county. So they're willing to be able to provide those particular services. In addition to the medical arm, they offer free food as well for those who are in need as well. And there's no questions asked. It is, basically no cost. And they utilize medical students from the University of Maryland Medical School. So they come in on Saturdays and offer those particular services. And that's including, blood work, including primary care, providing medication. So it's a full scope of services and wraparound services. So if you know of anyone who does not have insurance or limited insurance or, immigration status is in question, they're open and receptive and accessible to everyone in the community.
Thank you. That's a fantastic resource. Okay, well, that's all I have. Are there any other announcements that anyone would like to share?
What about our future speakers for next month that you want to share with the folks as well?
Actually, do you mind? Because I don't have that information out with me right now, and I don't want to.
It's Sharon Zielinski. Are you still on the line?
Yes, I am. It's the speakers will be Dr. Wormser and Annie Ali from the Primary Care Coalition, Montgomery County. The state was funded. There's a multi-year project to improve maternal health in the whole state of Maryland, but the startup projects were in Prince George's County, the Eastern Shore, and Baltimore. And they're implementing a program. They're implementing forms to make it easier to do referrals when people are identified, when pregnancy is identified, and particularly amongst higher risk pregnant people. There's a form that is sent out electronically so that people can be connected to not just one, but multiple service providers who can provide medical care, wraparound services, and all of those things. So this is a pilot program. It's going into its 2nd year, and they are going to come and talk about that and other maternal health initiatives in Maryland. It's now a priority, finally.
Wonderful. And they did a wonderful presentation with the University of Maryland Medical Systems. And I think everyone will find this will be very informative.
Wonderful. Thank you. And on the note of upcoming meetings, that monthly meeting will actually take place Thursday, September 18th, same time, same place. But we also have our virtual quarterly meeting coming up in a couple of weeks. So that's Tuesday, September 9th at 6 p.m. The link, it's hyperlinked on the slide, which you will get after the meeting, but also take a moment to scan the QR code so that way we can get you registered. And once you are registered, we will ensure that we send out that meeting link. So please make sure you register and we'll make sure you get that meeting link. But that is all that we have for you today. Again, thank you all so much for joining us and for just a lively discussion. I'm really excited about what comes out of this work group as it pertains to some of these changes with the administration and with Medicaid, and just making sure that our residents are really still getting that continuity of care and making sure that the resources are available, that they're accessible, and that they're easily understood, because there's a lot of information out there. So we want to make sure that they are getting the accurate, factual information. So again, thank you so much. Again, I'll leave this QR code up for another minute if you need to scan it to register for the upcoming meeting. Thank you all so much for being here, and have a blessed rest of your day and weekend.
And thank you for all that you do.
Thank
This is
you.
wonderful.
Thank you. Thank you.
Have a great
Have a good one,
afternoon.
everybody.
Thank you.
Bye-bye.